and I'm sending a shout out to all the amazing nurses out there. Keep doing what you do. My name is Edidion Udo. I am a registered nurse, and I'm on your screen to discuss a very sensitive topic, depression. But before I start, I'd like to say thank you to Health Circumference for helping to put this together and always giving us a platform to share, to educate, and to learn. What is depression? Depression is a mental state of low mood. It's a state where people begin to lose interest in enjoying life or simply being alive. And it can range from mild to severe. Depression is beyond just feeling sad or unhappy for a few days. So it could linger for weeks, months, and even years. What are the possible causes of depression? Childhood upbringing, life events like death, loss of a job, loss of a property, physical health conditions like diagnosis with some very bad prognosis or terminal illnesses, styles of thinking, you keep holding on to bad negative thoughts over and over, it keeps making you sad, weighing you down. It could lead to depression. Recreational drugs and alcohol could cause depression. Some medications could cause depression as a side effect, which is why it is important to know the medication you're taking. It's your right to know whatever medication you're taking. You know the side effects and you know what to expect from this medication, okay? Family history is also another possible cause of depression. What are the signs to look out for? Anger, consistently. All the symptoms are there. They are always there. They are persistent. They are always there. It's not, sometimes it could be in and out, but most times it's always there. Tiredness, anxiety, tearfulness, always crying over any and every little thing. Easily irritated. You don't just have interest in things like food, like sex, like activities, like people. And then over time, if nothing is done as an intervention, they begin to exhibit some lifestyle behaviors like withdrawal. They keep to themselves more. They don't want to share their problems, and they start feeling a type of way about themselves. Lack of self-confidence, that feeling of hopelessness, that feeling of worthlessness, that feeling of guilt, and always blaming themselves about everything. And if nothing is done still, it could then progress to them thinking of self-harm. Societal ideations begin to creep in, and at this point, people start thinking of ways to end their lives as a way to comfort or escape whatever problems they're going through. What can we do, or what do people need to do to deal or cope with depression? I'll first of all start by saying things you shouldn't do, which is running to the bar or buying excess alcohol and drinking yourself to stupor. That is not the best way to handle depression. Remember, I say that recreational drugs and alcohol can cause depression, so you don't want to use the cause of a problem to solve a problem. It's only going to create more problems. Suicide or self-harm shouldn't be a way or an option for dealing with depression. Isolation, please don't withdraw yourself. Instead, what you should do or you can do to cope with depression or deal with depression is to reach out to people, to stay in touch. Stay in touch with people, with your environment, with things. Be happy. And if you feel that you need to speak with a doctor, please do. Don't think that depression is not something to discuss with a doctor. Management of depression is a combination of so many things, from lifestyle changes to therapy to even medication. So yes, a doctor would be in the right position to help you through the process of depression, because it is not a quick fix process. It takes time. Okay, it's a process, and you need someone to go through this process with you. So seek medical help as soon as possible, or when you feel you should, but don't isolate. How about the people around you? Do you think about them? Well, if someone is not giving you goosebumps or making you feel sweat, that's fine. But just don't resort to self-harm or suicide. Okay? What can you do to help yourself while dealing with depression? Eat. Eat well, healthy, drink water, try new activities, try and learn new skills. Go out, take a walk, talk to someone. You should always have someone to confide in. Even if you don't want to talk to anyone, you can keep a journal where you write down your thoughts and everything, or you share your emotions down by writing. But just make sure you're doing something. Physical hygiene is a must. Yes, you don't want to look what you're going through. You don't want to look dirty. You need to smell nice. Make your hair. If you know how to do some makeup, please do some makeup. Brush your teeth. Wash yourself. Clean your environment, because a clean environment also is therapeutic. So keep your environments clean. It might help brighten up your mood. And for the people who are around, what can you do to help someone going through depression? Reach out to them. Talk to them. Be kind. Be compassionate. Don't just walk up to them and say, "I waiting be your own now. What is your problem? While I know they finish." No. Don't make a joke out of the situation. But be kind and compassionate when you are approaching people, because at this point they are very vulnerable and they are very sensitive. They might just need a smile or a compliment from you. Buy them gifts. Invite them to social events. Call them, check on them, chat on them, just to do something. If they're not accepting any help from you, reach out to someone who is close to them or a relative that you feel they may be comfortable to open up to, or even a spiritual leader if need be. But in all, let's be kind, let's stay happy, and stay safe. I hope we've been able to learn a thing or two, and we would be able to help someone, and in the end, save a life as well. Thank you so much for listening, and stay safe. Bye.